Hello everyone, it's April 21st, and before I get to the numbers of COVID positive cases today, I want to tell you about something that was concerning that I heard about earlier this morning. Our medical director, who has been in contact with the hospitals on an ongoing basis, tells me that they're seeing a concerning trend in people who are struggling with symptoms consistent with heart attack and stroke that are waiting too long to call for help. And what we're hearing is that people are concerned about the emergency room being full of people with coronavirus, and that just is not the case. Our emergency departments have lots of capacity. They're doing a great job of keeping those areas safe. And so I want to strongly encourage all of you that if you or a loved one are feeling chest pains, if you're experiencing facial weakness or arm weakness, or you're seeing trouble with a loved one in their speech, or you're having a difficulty with your speech, I want to encourage you to please call 911 and do it as soon as possible. We need to make sure that we're getting people suffering from those symptoms to the hospital as quickly as possible. Time is of the essence, and I don't want to lose anyone from heart attack or from stroke if those deaths could have been prevented, or if the consequences could have been lessened by getting timely care. So please call 911. So the COVID-19 update for the day. The state website tells us there are 32,000 cases across the state of Michigan. There are 2,468 deaths statewide. That total case count is an increase of 576 over the previous day. So we're starting to see that statewide number decrease day over day. Here in Kent County, we are, as of this morning, at 627 cases of COVID-19, which is the single largest increase that we've seen in one day. It's an increase of 77 COVID-19 cases since the day before. And we're at 25 deaths, which is an increase of 1 over the day before. So the big question is, why are we seeing this increase of cases here in Kent County while other parts of the state, or the state overall, are seeing a gradual decrease in cases? And there's a couple of answers that I want to talk about briefly. The first is that we're doing far more testing here in Kent County than we've been doing in weeks gone by. Our hospitals, private laboratories, Cherry Health, are doing significantly more testing than they were a few weeks ago. At the beginning of this month, there were only a few dozen tests being done on a daily basis. We're now at a point where hundreds of tests are being done daily. We're also seeing private places like Rite Aid come online. The Rite Aid in Kentwood is now doing testing as well. Here at the health department, we continue to test in settings where there are vulnerable populations. We've been at Mel Trotter over the past couple of days, along with help from Mercy, St. Mary's, and Cherry Health, to make sure that all of the residents there are being tested. And so we're seeing an increase in tests being done. And as we do that, it's no surprise that we're going to see an increase in cases identified. We're also seeing that the testing eligibility has expanded. Up until very recently, the only people who could get a test were those who were having extreme symptoms, including difficulty breathing. That criteria has now been expanded to include any person who is experiencing the symptoms of COVID-19. Coughing, fever, difficulty breathing. If you're experiencing any of those symptoms, you are now eligible to be tested. We're also seeing that first responders and other essential workers are eligible for testing if they've had an exposure to someone who's COVID-19 positive. If you fit any of those categories, I want to encourage you to please call your doctor's office, or go to the hospital's website, or to Cherry Health's website, or to riteaid.com, and they'll have a screening tool there. You answer the questions in the screening tool, and if you qualify for testing, they'll make sure to get you instructions on how to do that and where to go. The other reason I think we're seeing an increase in our numbers is because the actual prevalence of this illness continues to increase. That's not a surprise to us either. We know that the test positivity rate, which is the percentage of tests that come back positive, has gradually increased. Early on, we were seeing a test positivity rate of 2 to 4% coming back positive. Now, countywide and region-wide, we're looking at about 11% of those tests coming back positive. When we look at some of the more vulnerable communities, we're seeing a test positivity rate of 20 to 30%. And so all of those numbers are increasing. We know that we're not at the peak yet here in Kent County, or really probably anywhere in West Michigan. And we're experiencing this curve differently than the east side of the state. And that's not a surprise. And while we have suppressed the curve a great deal, we know that we're still a little bit on the upward trend, and we have probably at least a few weeks ahead of us of increases. And that's going to be something we're going to see across the state and probably across the country in the weeks and months to come, is that the curves are going to be shaped differently depending on a number of variables. And we should expect that we're going to hear about small clusters of outbreak and surges in cases on a periodic basis, and that's probably going to be the case for many months to come. So don't be surprised as the year goes by where you hear about small clusters of outbreak at a certain church or in a small town or in a certain employer, place of employment. Those things are going to happen because we still have so many people who are susceptible to this virus, who have never seen this virus before. So it's going to be a long haul. We really need everyone to stick together, and we need everyone to realize that this is not just an illness for older people or for the most vulnerable of people. And to give you an example of that, I learned this morning that we have 3 infants, 3 children under the age of 1 who are sick right now with COVID-19. Now, I think, and what I've heard is that they're doing well and they're expected to recover, but they are affected, and we have people in every age group that is suffering with COVID-19 at this time. So please remember, this is not some other person's illness. This is an illness that can affect everyone, and we need everyone to work together to make it difficult for this virus to spread from person to person. So please continue to stay positive, stay heroic, stay healthy, keep doing the things that you're doing in order to keep that curve flatter and more suppressed here in Kent County and throughout West Michigan. I'm Dr. Adam London with the Kent County Health Department, and I'll talk to you again tomorrow. Thank you.